The bar chart below shows the percentage of people in 5 different countries, Canada, Australia, Germany, India, and Brazil, who used the Internet in 2000, 2010, and 2020. Summarize the information by selecting and reporting the main features and make comparisons where relevant.
The bar chart illustrates the percentage of Internet users in 5 countries, Canada, Australia, Germany, India, and Brazil over 3 distinct years, 2000, 2010, and 2020. Overall, all countries experienced a significant increase in Internet usage over the 2 decades, with Canada and Australia consistently leading in terms of the highest percentages. In 2000, Canada had the highest proportion of Internet users at around 50%, followed closely by Australia at approximately 45%. Germany and Brazil had similar figures at about 30% and 25% respectively, while India lagged behind with just 5%. By 2010, Internet usage had surged in all countries, with Canada and Australia reaching around 80% and 75% respectively. Germany and Brazil also saw substantial growth, with figures rising to about 60% and 50%, while India's Internet usage increased to 20%. By 2020, the gap between the countries had narrowed, although Canada and Australia remained at the forefront with Internet usage rates of 95% and 90% respectively. Germany and Brazil reached 85% and 80%, while India showed the most dramatic increase, jumping to 50%. Despite this growth, India still had the lowest percentage of Internet users among the 5 countries.
Some people believe that the best way to improve public health is by increasing the number of sports facilities. Others, however, think that other measures are required to improve public health. Discuss both views and give your own opinion.
The question of how best to improve public health is a contentious one, with some advocating for an increase in sports facilities and others calling for a more comprehensive approach. Both perspectives have merit, but a balanced strategy that incorporates multiple measures is likely to be the most effective. Proponents of increasing the number of sports facilities argue that such facilities provide people with the opportunity to engage in physical activity, which is crucial for maintaining good health. Regular exercise can help prevent a range of health issues, including obesity, cardiovascular diseases, and diabetes. For example, cities with ample parks, gyms, and swimming pools often report higher levels of physical activity among their residents. Moreover, sports facilities can serve as community hubs, fostering social interactions and mental well-being. On the other hand, critics of this approach argue that simply providing sports facilities is not enough to improve public health. They point out that other factors such as diet, education, and access to healthcare play a significant role in determining overall health outcomes. For instance, even if people have access to sports facilities, poor dietary habits can negate the benefits of regular exercise. Therefore, public health initiatives should also focus on promoting healthy eating, providing health education, and ensuring that everyone has access to quality healthcare services. In my opinion, while increasing the number of sports facilities is an important step, it should be part of a broader public health strategy. Governments should also invest in educational campaigns to raise awareness about healthy lifestyles, subsidize nutritious foods, and improve healthcare access. By addressing multiple determinants of health, we can create a more holistic approach to improving public health.
In many countries, the amount of waste produced by households is increasing. What are the causes of this problem and what measures can be taken to address it?
The increasing amount of household waste is a pressing issue in many countries, driven by factors such as consumerism, packaging trends, and lack of recycling infrastructure. Addressing this problem requires a multifaceted approach, including public awareness campaigns, government regulations, and technological innovations. One of the primary causes of the rise in household waste is consumerism. In modern societies, people are encouraged to buy more goods, leading to higher consumption rates and consequently more waste. Additionally, the prevalence of single-use products and excessive packaging exacerbates the problem. For example, many products come in multiple layers of packaging, much of which is non-recyclable and ends up in landfills. Another contributing factor is the lack of effective recycling infrastructure. In many countries, recycling facilities are either insufficient or non-existent, making it difficult for households to dispose of their waste responsibly. Even when recycling options are available, the lack of public awareness and education on proper waste segregation often results in contamination of recyclable materials, rendering them unusable. To address this issue, several measures can be implemented. Firstly, governments should invest in robust recycling infrastructure and make it easier for households to recycle. This could include providing separate bins for different types of waste and offering incentives for recycling. Secondly, public awareness campaigns are essential to educate people about the importance of reducing waste and proper waste disposal methods. Finally, technological innovations such as biodegradable packaging and waste-to-energy technologies can play a crucial role in minimizing the environmental impact of household waste. In conclusion, the increasing amount of household waste is a complex problem driven by consumerism, packaging trends, and inadequate recycling infrastructure. Tackling this issue requires a combination of government action, public education, and technological advancements to create a more sustainable waste management system.